In South Africa's research labs, a revolution in food technology is taking shape. For millions suffering from dysphagia and difficulty swallowing, eating is a daily struggle. Today, we explore how 3D printing is transforming texture-modified foods from unappetizing mush into nutritious, dignified meals.
In the past years, I have seen many elderly people, including family members, dished up with unappetizing diets such as soft porridge and mashed food every single day of their lives. Imagine yourself in that situation. After knowing about 3D food printing technology and its possibilities for customizing food in terms of texture, nutrition, and appearance according to individuals' needs, I decided to explore the feasibility of this cutting-edge technology to develop 3D printed diets for dysphagia patients in order to improve their health, quality of life. Dysphagia is a condition or state whereby a person experiences some difficulties when chewing and swallowing ordinary food. It is an impaired swallowing mechanism that affects how food moves from the mouth to the stomach. Among the age groups, the elderly population is more susceptible to dysphagia because as aging progresses, there are various physiological and anatomical changes happening in the human body that can lead to dysphagia. And some good examples include loss of teeth, muscle reduction, and medical conditions like stroke and most degenerative diseases. This isn't just about medical condition. Dysphagia fundamentally compromises human dignity and social participation in food culture.
Our center serves as a leading innovation hub that transforms laboratory discoveries into real-world solutions and societal impact. At the Center for Innovative Food Research, we focus on developing sustainable, nutritious, and culturally relevant food technologies that tackle food insecurity and improve public health. What actually sets us apart is our commitment to using indigenous African food sources and knowledge systems. And in so doing, we are not just innovating, we are also preserving our heritage while solving modern challenges through advanced technologies. In this particular context, 3D food printing. This research of ours is particularly crucial for Africa because we face a unique intersection of challenges. With millions of people globally affected by dysphagia and many in Africa lacking access to specialized care, this technology of ours actually offers hope. We are not only addressing our continent's burden of malnutrition through customized nutrient-dense foods, we are also looking after our rapidly aging population's healthcare needs.
We start with raw ingredients like indigenous food sources, such as mopane and orange flesh sweet potatoes. Indigenous food sources are dried and ground into a flour. Thereafter, the flours are composited and hydrated along with some additives to form a uniform formulation. The formulation is then cooked to obtain a soft and eatable meal that can easily be swallowed by dysphagia patients. To ease printing. Simply put, one of the biggest challenges of 3D food printing is achieving the right rheological properties for printability while maintaining palatability. Unfortunately, mopane and orange flesh sweet potato in their native form are not printable. Therefore, when dealing with these types of food materials, the cautious use of hydrocolloids and various processing techniques that can also beneficially modify the composition, behavior, and printability of both substrates are some of the strategic decisions that need to be dealt with. To ensure that these foods are compliant with the IDDSI requirements, we followed the 8-level framework using standardized testing, including spoon tilt test, fork pressure test, and fork drip test to investigate their suitability for dysphagia patients. This IDDSI test also provides some insights into the textural characteristics of food material. Particularly in this project, this IDDSI test demonstrated that our product comply with the IDDSI requirements. To be specific, these food products were easy to scoop using a spoon and easy to smack using a fork, meaning that they could be easily swallowed by dysphagia patients without the risk of choking, according to the IDDSI framework.
The difference for 3D food printing is actually transformational. Traditional texture modification methods often result in bland, unappealing, unrecognizable meals that some might even say strip away dignity. 3D food printing actually changes this completely by offering precise, programmable texture control and visually appealing, recognizable food shapes that enhances appetite and is also safe for dysphagia patients. It also enables personalized nutrition, gives the possibility for fortification and efficient production, reducing manual labor, and actually provides much more better customization when you compare it to traditional methods. The balancing act is somewhat delicate, I must say, and that is where our expertise in food science and technology becomes very crucial to retain key nutrients and also beneficial constituents during processing. We also then had to optimize our food ink formulation to ensure that the texture is soft enough for swallowing, but also firm enough to hold the shape during and after 3D food printing.
Indigenous food sources like mopane worm and orange flesh sweet potatoes are affordable and easily accessible ingredients, especially in South Africa. Regarding their nutritional profile, mopane worms are rich in protein, with levels that can be up to 3 times higher than those found in chicken and beef. Additionally, mopane worm are also excellent source of omega-3 fatty acids, with the potential to alleviate the risk of some cardiovascular diseases. On the other hand, orange flesh sweet potato is a good source of beta-carotene, high in carbohydrates and dietary fiber, including health-promoting compounds such as flavonoids and phenolic acids, with biological benefits. Clearly, combining these two indigenous food sources can create a formulation with balanced nutritional and health advantages. By transforming indigenous food sources into a novel food product, these researchers paved the way to show that traditionally and culturally rooted ingredients can play a significant role in modern food products. 3D food printing is a sustainable food processing technology, flexible enough to allow people to choose the ingredients of their choice and develop food products that can align with their lifestyles and values. So in many ways, 3D food printing, as we have adopted in this study, advocates for food sovereignty.
Food sovereignty isn't just about nutrition. It's about preserving who we are. Research has consistently shown that indigenous communities do have better health outcomes when traditional food practices are maintained. Our approach therefore integrates traditional foods with modern nutritional requirements, basically creating a fusion of adequate nutrition and preserving cultural identity, and particularly in this context, geared more towards healthcare settings. And one can imagine if a patient in a South African hospital can eat a nutritious meal made from locally available mopane worm and orange flesh sweet potato. We are not just feeding their body, we are nourishing their soul, but also honoring and acknowledging their cultural heritage. Cost is certainly a challenge in terms of the equipment itself and its associated maintenance. Many facilities are also still unfamiliar with 3D food printing, and most of them probably do not even have infrastructure for it. Another one to touch on is also awareness. But what is encouraging is that research done within the center as part of another study has shown that when South Africans understand the actual benefits of 3D food printing, acceptance dramatically increases. So the real barrier is awareness, not rejection. We are, however, working on scalable models and training programs to bridge some of these gaps that I've mentioned. Patient validation is our immediate priority over the next couple of months. We cannot possibly move forward without their voices. Subsequent scale-ups and refinements for a ready-to-use system will then follow, which is already underway. I mean, the global 3D food printing market is projected to grow from $398 million to over $7 billion by 2034. We are actually positioning South Africa to lead this transformation in the continent. I am optimistic that we will see implementation within the next couple of years, 4 or less in specialized facilities. To the best of our knowledge, 3D food printing, particularly for dysphagia, is not yet used in the South African healthcare system. But there are promises due to positive consumer attitudes and the country's growing 3D food printing ecosystem, and globally as well. At the Center of Innovative Food Research, we are also going to commence small-scale pilots in this area. some regulatory hurdles, food neophobia that may delay adoption. But if we align this with data supporting clinical effectiveness and building on our previous work in this area and in other parts of the world, I think we can actually accelerate integration.
This isn't just about technology. It's about dignity, nutrition, and using our local resources to solve global health challenges.
I strongly believe that this technology will transform patient dignity one meal at a time.